Did you know there are 7 health conditions that could cost you your driving license or even land you with a £1,000 fine if you don't tell the DVLA? Every year, thousands of UK drivers are hit with penalties, have their insurance cancelled, or even face prosecution, all because they failed to report a medical condition they didn't think mattered. If you drive, or someone you love does, this might be one of the most important videos you watch today, because in the next few minutes, you'll find out exactly which conditions you must declare, how to do it properly, and how to protect yourself from life-changing penalties. First, the big why. Why does the DVLA care about medical conditions and driving? Because driving is a task that depends on physical ability, sight, decision-making, reaction time, coordination, alertness, and the ability to respond to the unexpected. If a medical condition reduces or impairs any of these, the risk on the road may increase for you, your passengers, and everyone else around you. The law is clear. If you hold a driving license and you develop a medical condition, or it worsens, that could affect your ability to drive safely, you must tell the DVLA. In fact, failing to tell the DVLA about a notifiable medical condition can lead to a fine of up to £1,000. And if you're involved in an accident where your undeclared condition was a factor, you could be prosecuted and your insurance might be invalid. So let's dig into 7 key health conditions you'll commonly find in lists of conditions that must be declared, or at least must be checked. These don't cover every condition. The DVLA publishes an AZ list covering many more, but these 7 are among the most critical and frequently mentioned. For each one, we'll explain why it matters, what you should watch out for, and what to do. 1. Insulin-treated diabetes. If you have diabetes and you're treated with insulin, this is one of the conditions the DVLA pays close attention to. Why? Because insulin treatment introduces the risk of hypoglycemia, low blood glucose, which can impair alertness, cause confusion, fainting, or loss of consciousness. That situation behind the wheel is obviously very dangerous. The guidance states that if your diabetes is controlled only by diet or tablets, you may in many cases continue to drive without notifying. But if you are treated with insulin, or you've had episodes of severe hypoglycemia, impaired awareness of hypoglycemia, or vision or nerve damage, neuropathy, affecting your driving, you must notify the DVLA. What should you do if this is relevant for you? Check with your diabetic specialist/GP. Are you on insulin or at risk of hypoglycemia? Are you aware of any blackouts, fainting, or sudden loss of control? If yes, you must complete the relevant DVLA medical questionnaire and send it in. Inform your insurer too. They need to know. If you don't declare when you should and you have an incident, you may lose your license, be fined, or your insurance claim may fail. 2. Epilepsy, seizures and fainting, syncope, fits, blackouts, sudden unconsciousness spells, all of these raise serious issues for driving safety. The DVLA is clear that if you have epilepsy or a history of seizures or episodes of unexplained fainting, syncope, which may impair control of the vehicle, you must tell them. Why? Because even a single unexpected seizure behind the wheel can lead to catastrophic consequences. The DVLA must assess whether you meet the fitness to drive standards, and they may impose restrictions, shorter license periods, or in some cases, suspend driving until you're safe. If you develop your first seizure, or your seizure frequency increases, or your doctor advises you not to drive, you must stop driving and declare the condition to the DVLA. 3. Serious heart conditions/cardiac events. When we talk heart conditions, we're covering things like arrhythmias, irregular heartbeats, pacemaker insertion, recent heart attack, angina, or conditions that could cause sudden incapacitation. The issue is, if you collapse or lose consciousness at the wheel due to a cardiac event, the risk to you and others is extreme. The DVLA lists heart conditions, including pacemakers, atrial fibrillation, AF, as among those you must declare. What to do? If you've had a major heart event or heart surgery, check with your cardiologist whether you can drive and whether you must inform DVLA. When you fill in your license renewal or new application, answer honestly about heart conditions. If you develop symptoms, chest pain, blackouts, arrhythmia, after you have a license, you must inform the DVLA. 4. Stroke transient ischemic attack, TIA neurological conditions. If you've had a stroke or a TIA, your ability to drive safely may be impacted through weakness, vision issues, cognitive impairment, lack of control, or coordination problems. The DVLA makes clear that in such cases you must declare. elmplegal.co.uk 5. More broadly, neurological conditions such as multiple sclerosis, Parkinson's disease, brain surgery, repeated dizzy spells, fainting, or conditions affecting the central or peripheral nervous system are covered. What to do? If you have had a stroke or you've been diagnosed with a progressive neurological condition, talk to your neurologist and check your driving status. Don't assume just because I'm allowed to drive now means you don't have to tell the DVLA. If the condition affects your ability to drive safely, you must notify. Complete the relevant form, get medical evidence if asked, and wait for the DVLA decision. 5. Sleep disorders, including obstructive sleep apnea and narcolepsy. Driving safely depends on vigilance, alertness, and being able to react quickly. Sleep disorders, especially those that give excessive daytime sleepiness, sudden onset of sleep, or lapses in attention, can severely impair driving. The DVLA highlight disorders such as obstructive sleep apnea syndrome, OSASA, or narcolepsy, as ones you must tell them about. Key points. If you have excessive daytime sleepiness, not explained by lifestyle alone, speak to a sleep specialist. If you've been diagnosed with sleep apnea, you may need to treat it. CPAP, and show you're compliant before being allowed to continue driving. If you have narcolepsy, which includes sudden sleep episodes, you must inform the DVLA. Driving while drowsy is almost as dangerous as drunk driving, so the legal requirement is taken very seriously. 6. Vision and eye conditions. Your ability to see clearly, respond to hazards and judge distances is key to safe driving. The law requires you to meet certain minimum eyesight standards. If a new condition arises or worsens, you may need to declare it. The DVLA list conditions affecting both eyes, or total loss of sight in one eye, or changes in your vision which could impair driving. Examples include glaucoma affecting both eyes, or your only seeing eye, sudden loss of vision or visual field defects, conditions affecting perception of light, contrast, or speed. What to do? Have regular eye tests. The NHS recommends every 2 years, and if your optometrist or ophthalmologist says your vision is below the driving standard, you must tell the DVLA. Complete the declaration form specifying your condition. Send in any reports requested. If your license continues, you may be subject to periodic review or eyesight checks. 7. Mental health conditions. Mental health is increasingly being recognized as relevant to driving. While many people with anxiety, depression, or other conditions may drive safely, the DVLA says you must declare certain diagnoses, for example, bipolar disorder, schizophrenia, psychosis, or any condition with behavioral disturbance, memory/concentration problems, or where treatment may impair alertness. If your diagnosis is something milder, e.g., mild depression, but you have no impact on driving, the requirement to inform may not apply yet. You should always check with your doctor or the DVLA guidance. What to do? If you are diagnosed with a serious psychiatric condition or your psychiatrist or GP raises concerns about your fitness to drive, you must inform the DVLA. Be honest on the health section of your license application/renewal. If you notice your medication affects your driving, sleepiness, changes in reaction time, that is a red flag. What happens after you notify the DVLA? Once you have told the DVLA about a condition, they will review the information you submit, including any medical reports, and decide what happens. They may allow you to continue driving without changes. Grant a license for a shorter period, 1, 2, 3 or 5 years, rather than the usual 10-year adult license. Require you to adapt your vehicle, for example, hand controls, modified pedals. Tell you to stop driving if your condition means you no longer meet the medical standards. It is not automatic that you will lose your license just because you have a condition. Many drivers continue to drive safely under restrictions or regular review. The key is safety. Consequences of not declaring. Let's be very clear. Not declaring a relevant condition is legally risky. The consequences include a fine up to £1,000 for failing to inform the DVLA. You could be prosecuted if you are involved in an accident and your undeclared condition was a factor. Your car insurance may become invalid. If you have an accident and your insurer finds you failed to disclose a condition that affects driving, they could refuse your claim. You may face sudden license suspension if the DVLA learns of the condition from another source. Therefore, it's far better to declare and be assessed than assume nothing will happen. What you should do right now. If you're driving or applying for a license, or you have a medical condition, or are about to develop one, here are the steps. 1. Review your health. Check whether you have any of the conditions we discussed and others, or if you've developed new symptoms. 2. Use the DVLA's online AZ medical conditions list to check whether your condition needs reporting. 3. If you do need to report, complete the appropriate form, medical questionnaire. Fill in your license number, date of birth, contact details, send any requested medical evidence. 4. Contact your GP or specialist if you're unsure whether your condition qualifies. Ask, does this need to be declared to the DVLA? 5. Inform your motor insurance provider about your condition, especially if you are required to inform the DVLA. 6. Do not drive if your doctor says you must stop driving for a period of time, e.g., after a major heart event, seizure, stroke, until the DVLA decision is made. 7. Keep records, save copies of all notifications to DVLA, any correspondence, your license renewal information, medical reports. 8. When you receive the DVLA decision, read it carefully, follow any conditions, e.g. restricted license, review period, vehicle adaptation, and comply. Failure to do so could invalidate your license.